I want to talk a little bit about the connection between the state and the federal stuff. Really from our perspective at the Healthcare for Everyone campaign, the state and federal debate on this issue are two sides of the same coin. All the things that Ethan laid out in his analysis of what it is that people want about healthcare, you know, peace of mind, quality choices, more for our money, healthcare we can count on, all of those things are the same, no matter whether you're talking about what you want them to do in DC or what you want them to do in Connecticut. The interesting thing here in Connecticut, though, is that we can really lead the nation on this issue if we are brave enough to do so at the state level. And the bill that we're talking about, Sustanet, which is from the state motto, which is Latin for to sustain, is a proposal that has been put together over a couple of years and represents everything that Ethan just talked about in his presentation earlier on. And the reason that Tom laid out at the beginning about why it's important for us to do this here at the state level is not only that we could get ahead of the curve and start providing these quality choices for Connecticut folks as soon as possible, but we could also have the state of Connecticut be action ready to implement whatever comes down at the federal level, so that when they pass something in DC, Connecticut can be ready to hit the ground running, that we can start to get the infrastructure up and running to have this public health insurance plan here as an option here in Connecticut. And if you're worried about the budget, and I know John Garagosian was here earlier, the chair of our appropriations, if you're worried about the state budget, it also could position to be in a better place to take advantage of more federal resources to help us implement healthcare at the state level. I just want to talk a little bit about the groups of people that are involved in this. Many of you saw the brochure that we were handing out about Sustanet that talks about the diverse groups of constituencies that are concerned about this. And I think one of the most interesting things about what's been happening here in Connecticut, which is a model for the nation, is the breadth and depth of involvement we have had in developing Sustanet over an 18-month period with some new players at the table that maybe 15, 20 years ago when we started working on healthcare, we would never expect to be at the table with us. For instance, the Connecticut State Medical Society endorsed Sustanet. The doctors and healthcare providers around the state, not just the doctors, but other people who are on the front lines of dealing with healthcare and the broken system that they were working with, feel as much victims, I think, by the way the insurance industry is running healthcare in this country as the people who can't get the care that they need. It's a huge, huge issue. And the healthcare community has come to the table this time around in this debate and said, yes, and we believe this is a good way to go. And it will give us more power to practice the kind of medicine that we need to practice to serve the people that come to us and help get them well and help keep them healthy, more importantly. The one different thing about Sustanet is that unlike a lot of other proposals that talk about getting people insurance, Sustanet really focuses on changing the way we deliver health care so that we focus more on primary care and prevention and keeping people healthy so that we don't have to spend more money over the long run taking care of them, management of chronic illnesses, things of that sort. So there's a whole investment in Sustanet in that type of healthcare delivery reform, as well as offering the public plan option to folks. And we think that's an important piece of the puzzle. We wanted to learn from states like Massachusetts that did a great thing, but they haven't quite figured out how to do the investment in the delivery system and control costs. And so what our proposal does is do those kinds of things. So even if something happened at the federal level that didn't quite get there on those things, we could still be doing that in Connecticut and lead the nation and show the way to quality, affordable health care that controls costs over time, which I think is a really important thing if we want to get control of how much of our state and federal budget we're spending on healthcare, not to mention household budget. In fact, I heard an astonishing statistic the other day that 50% of foreclosures now are related to medical debt. It's not just that people are having bankruptcies related to medical debt, but foreclosures. Because now as more people lose their health insurance because of lack of employment and they can't afford COBRA or whatever, they've gotten behind. And now as employers are offering fewer and fewer benefits in exchange for your premiums. At any rate, I want to just close by saying why I think, oh, one more thing. The other special partner we've had at the table is the small business community. 80% of all the new jobs generated in our economy are from small businesses. The small business community has largely been left out of the debate about what the solution should be. The business community has been represented by big business and folks like the Connecticut Business and Industry Association, who make an extreme amount of their budget off of selling insurance products. So they all have a vested self-interest in the status quo. What's left out of the equation, and even many of the chambers of commerce don't have a lot of small micro businesses and mom and pop shops that belong to them. Left out of the equation is that business voice. And there's a new group in Connecticut called Small Businesses for Healthcare Reform, which has been involved in the development of Sustainant. And Sustainant is particularly designed to allow small businesses in without breaking the bank. And I think that's a very important way of getting many people who are underinsured and uninsured insured in the state of Connecticut. In fact, the leader of Small Businesses for Healthcare Reform, just found out on Thursday night, has been invited down to the White House next Thursday to be one of 8 business people from around the country to go to the White House to talk about what small business needs for healthcare reform. And I think that's great. What we've heard from members of Congress and from Senator Dodd is that they haven't been hearing from that constituency in an organized manner, and that's great. So we can lead the nation. We have a very great legislative delegation. We have leadership in the House and Senate, particularly from the Speaker of the House, Chris Donovan, on this issue. And Don Williams has a long history, the President of the Senate, on health care and understands this issue. We have a great delegation. We have a field operation in the Healthcare for Everyone campaign. We have a diverse cross-sector group of folks involved in this fight. And we can, in the next 2 months, pass significant legislation here in the state of Connecticut that can set us on the road to lead the nation and be on the cutting edge.